Okay, so you have a patient who is bradycardic and he's just laying in bed right now, complains that he's super weak. You arrived and you've already put the 4 lead on your patient, and this is what you see on the monitor so far. So, what else do you want to do once you find your patient sitting here? He's alert and he's talking, but he's super slow in how he's talking to you, and he just doesn't feel like he can get up, maneuver around.
Check his SpO2, maybe use some oxygen.
So when you put SpO2 on him, you get an oxygen saturation of around 90%. And you put your oxygen on what flow rate you want.
2 liters.
Okay. So, with your patient and the way that he is right now, what do you want to do for him to get his heart rate back up?
Could pace him.
We could pace him.
Or
What else could we do?
benzene.
Well, if his heart rate was too fast, you give it benzene. But since it's too slow, you want to give atropine.
Atropine.
So you start an IV on him, you give him 1 dose of atropine. How do you give your atropine?
Push with the flush.
Perfect. You push it, this is what you get. After waiting, it still didn't do anything. What do you want to do now? He's still stable sitting with us, but your first dose of atropine didn't pick up his heart rate.
Do the second dose.
Perfect. And what do you want to do with your second dose?
Push it with the flush.
And how much are you going to give? The same or more?
More.
Perfect. So you push it. Unfortunately, it didn't do anything either. Kicked up a little bit, but then immediately went right back down. Now what do you want to do?
No. Peace.
Yep. So here's your picture pads. Red goes on the side on our mannequin, and the white one goes up on the top shoulder. Alright, so you're gonna pace him, and you can pace him with our monitor at full dose. Our pacer button is the green one. And then in order to use ours, we want the rate to be at 70 and we want it to be demand. The output you're going to change, but if you change this now, you're not going to see anything on the monitor. You need to start pacer and then go up to your output. This one. And then this will start printing, but we're going to stop that, otherwise it's going to run out. And then now you need to change your output so that the pacer is connecting with the rhythm. And of course, with this kind of patient, what would you do to him since he's still awake?
Tell him you'll feel something.
Well, you can sedate him a little bit. He's gonna feel mild because we're only giving him low dose on here. So once you get into there, you just keep increasing it until your waves start connecting here. And they will. Perfect. Yep. And you want to go that 10 over like you did. And then to confirm it, I just go back out of here. And if you go all the way down to here, this will show you what it's doing. And then to get back into there, you just hit pacer. So you're pacing him, you're talking to him more, you're getting some more information. He's got congestive heart failure. He's got an extensive cardiac history. As you keep going with him, he ends up, you notice the monitor does this. Oh, you're still pacing. What's your new rhythm that you have? You see it there, but you feel a pulse at the same time. There's nothing there. What do you want to do?
Shock.
But he has no pulse.
Oh, CPR.
Perfect. So we start CPR on him. And as we're doing CPR, how often do we check him? Okay. And what medications are you going to want to give now? What meds do you want to give him now that you're doing CPR? And it's a non-shockable rhythm.
Epi.
And what dose do you want to give him? 1 milligram,
Well,
1,000. And so you give that, you check him after a little bit. What do you see?
Same thing.
Do you see a nice sinus rhythm? Do you have a pulse to go with it?
No.
No pulse, what do you want to do?
Continue CPR.
Perfect. We should do it for 5 minutes.